Welcome to my channel Psychology Today. Don't forget to like, subscribe, and hit the bell icon. Dissociative identity disorder. Dissociative identity disorder, DID, formerly known as multiple personality disorder, is the most common type of dissociative disorder in which a person experiences two or more distinct personas or identities, each with its own set of thoughts, feelings, and behaviors. Symptoms. Depending on the type of dissociative disorder you have, you may experience the following indications and symptoms: memory loss, amnesia, for specific time periods, events, individuals, and personal information; a sense of being disconnected from yourself and your emotions; a perception of the people and things around you as twisted and unreal; identity confusion; significant stress or problems in your relationships, career, or other important aspects of your life; inability to cope well with emotional or professional stress, suicidal ideas and acts. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, of the American Psychiatric Association specifies 3 basic dissociative disorders. Dissociation-induced amnesia. The chief symptom is substantial memory loss that is not explained by a medical condition. During a stressful phase, you are unable to recollect details about yourself, events, or people in your life. Dissociative amnesia might be limited to a specific event, such as intense fighting, or it can be broad. Can culminate in the complete loss of one's memories of oneself. It may entail travel or a confused wandering away from your life on occasion, dissociative fugue. Amnesia usually strikes suddenly and might last minutes, hours, months, or even years. Dissociative identity disorder. This condition, previously known as multiple personality disorder, is distinguished by switching to different personas. You may be aware of 2 or more people conversing or living within your head, and you may feel possessed by other personalities. Each identity may have a unique name, personal history, and features such as evident differences in voice, gender, mannerisms, and even physical attributes, such as the need for glasses. There are also differences in how each identity interacts with the others. Dissociative amnesia and dissociative fugue are usually connected with dissociative identity disorder, the syndromes of depersonalization and derealization. This is characterized by a continual or episodic sense of detachment or being outside of oneself, observing one's own behaviors, feelings, ideas, and self from afar, as if watching a movie. Depersonalization. Other people and items in your area may look detached, fuzzy, or dreamlike. Time may appear delayed or sped up, and the environment may appear surreal. Derealization. It is possible to have depersonalization, derealization, or both. Symptoms, which can be distressing, might last only a few minutes or for years. The following elements may be included in an evaluation. Physical examination. Your doctor checks you and interviews you in depth about your symptoms and personal history. Certain tests can rule out medical conditions that cause symptoms like memory loss and a sense of disbelief, such as head injury, certain brain illnesses, sleep deprivation, or intoxication. Psychiatric examination. Your mental health professional will quiz you about your thoughts, feelings, and behavior, as well as discuss your symptoms. With your permission, information from family members or others may be valuable. Treatment. Treatment for dissociative disorders varies depending on the disease, but it typically includes therapy and medication. Psychotherapy is the primary treatment for dissociative disorders. This sort of treatment, also known as talk therapy, counseling, or psychosocial therapy, is discussing your condition and its complications with a mental health professional. Your therapist will collaborate with you to identify the underlying source of your issue and to establish new coping mechanisms for stressful circumstances. Your therapist may be able to help you communicate more about the trauma you experienced over time, but only if you have the required coping skills and a relationship with your therapist. Medication. Although there are no drugs specifically developed to treat dissociative disorders, your doctor may prescribe antidepressants, anti-anxiety meds, or antipsychotic medications to help.